how do you know when you're being overly medicated? Because some people think, well, my doctor said I need this. Well, I need this. Well, I need this. I know people that are taking way too many medications, and I'm going, are you sure? I mean, I'm not a doctor, but are you sure? So, from a doctor's mouth, what is your freedom from pharma? How does it work? How do they join? And then how can people tell, like, if they're a candidate?
Yeah, I'm happy to share because freedom from pharma, I am liberated. So I want to liberate others. I want them to say they can own their own health and live in health sovereignty. And that's really what freedom from pharma is. And it's a journey. Like, it didn't take people, 2 months to get on 10 medications. It's a
Right.
prolonged, years and years and years of that happening. And so to come into a program, it's the beginning steps are small. Okay, let's walk through what are the medical conditions you're told you have, right? Because sometimes they are caused by the medications, sometimes they're caused by lifestyle choices. So let's walk through and see what you're told your medical conditions are. Okay, now let's look through the medications you're on. And the best part of this is who's helping the patients become free are other wellness pharmacists like myself. So how about a kick to big pharma right there? It's like, yeah, exactly. These are pharmacists like myself who saw that the industry was not looking out for people. And the reason we became pharmacists were to help. And
Mhm.
so you come in, you meet with a pharmacist, you go over these basic, low level questions. And then from there, it's like, okay, let's try a supplement, or let's try lifestyle changes. Let's try nutritional changes, small steps. And then once the individual feels that they are capable to then meet with a provider and discuss their medications and start to taper, then that can happen. But a lot of times it's not a few months. This is a journey. This is time. This is, deep conversations with these pharmacists and going over anything you can think of as to what made you start this medication. How did you get from here, like you're saying, a 25-year-old with just a knee injury, to now maybe someone in their 40s that's now on 5 or 6 different medications? It's really layers, and it's going through, and it's really good. We've had a few people come in already who were not on a lot of medications, but just said, I want to start to come off of these. We've had about 15 people now graduate. So for just a short
Wow.
window of having this program, some have come in and said, I just want reassurance to know I'm doing the right things. Can you just help me know? Because I don't know who to trust. And I trust
Yeah.
you guys at the wellness company. So we
Yeah.
had a few come in who just needed that reassurance. Some people just want to know what really a diet should look like, because they don't
Mhm.
trust the guidelines that are being put out there now. So they're looking to say, what should I eat? Is it okay to have this? So we have a few like that. And there are patients we are working on right now who are coming off of these toxic medications that they've been using for years, and it numbs them to life. That's the sad part of this whole thing.
Yeah.
They are so disconnected. They have no idea what's happening around them. And they're just covering something that happened in their life at one time just because they didn't know how to deal. And not only not know how to deal with it, you're taught that to feel a negative emotion is wrong. It's part of
Right.
being human, and you have to work through
Yeah.
that. It's not wrong or bad. It's okay. It's okay to have a moment of sadness. It's okay to have anxiety and a struggle at a time. But what's not okay is to pretend it's not real.
Right.
Mask it, because then you're harboring a disease somewhere in your body. So that's what freedom from pharma, we're trying to liberate people, give them back ownership over their own health. These are their choices. These are their health goals. And over time, they can start deprescribing one by one at a time, of the unnecessary medications. I mean, you probably hear this, and I believe this. Not all pharmaceuticals are bad. If that were
Right.
true, we wouldn't have ivermectin and hydroxychloroquine.
Haha, true.
So they're not bad, and due to some choices people have made, they need to be on some blood pressure medications and some heart medications. Those are very necessary. But there are medications that people can come in, ask, and seek guidance, and we will help them figure out those medications that they can come off of.